I'm going to change the order up just on one bill, and that is Representative Zemke's bill. Which is 1175. And I think what I'd like to do is let you explain the bill, and then we do have an amendment. I think we have an amendment on your bill, don't we? Yeah, but is it easier to explain the bill and then discuss the amendment?
Yes, because you have the amendment.
Okay.
Thank you, Madam Chair and members of the committee. I miss being on the Health Committee, by the way. This bill is 1175. I wanted to bring this to you because I feel it is so important in the work that we are doing as a state in addiction treatment. And this bill was brought to me by one of my local hospitals in my district, and they have established an intensive outpatient rehab program. What this bill does, and I'm amazed at the amount of support throughout all of the different groups for it, is it allows for Medicaid billing by licensed clinical social workers, licensed mental health counselors, licensed clinical addiction counselor, licensed marriage and family therapist, if they are eligible providers, that they can supervise and bill for their plan of treatment for these services. What we have found, especially in southeastern Indiana, is it's really become a workforce and a resource issue for being able to provide all of these services, especially in Ohio. They do not have the oversight mandate. So it's much more difficult for us to hire in our area for LCSWs in regard to this. So if, could I possibly have CEO Putnam come up with Margaret Mary Hospital, or would you like to address the amendments first?
Right, we'll do that. We'll ask Mr. Putnam in a moment. Okay. But I wanted to discuss the amendment. So I'd like to offer an amendment to Representative Zemke's bill. Page 1, line 3. Delete the word A. Well, and insert a semicolon. And then page 1, delete lines 4 and 5. And begin a new block that says a licensed, and these are the individuals that would be able to sign off on a treatment plan: a licensed clinical social worker, a licensed mental health counselor, a licensed clinical addiction counselor, and a licensed marriage and family therapist. And then page 1, line 6, delete family therapist, and page 1, line 8, after if, insert the individual holds at least a master's degree. And then we do have an individual who can explain that a little bit more, that represents the Community Mental Health Center. So if the committee would indulge me by accepting this amendment, thank you, consent. So we have an amended bill, and then we will talk to our witnesses and let them explain it a little bit more for us. And Tim Putnam, CEO of Margaret Mercy Hospital. Matt Brooks, you'll be on deck.
Thank you, Madam Chair.
Thank you, Madam Chair, members of the committee, and Representative Zemke for bringing this forward. I'm CEO of Margaret Mary Health. We serve Ripley and Franklin County, and like Representative Zemke alluded to, that we are very close to the Ohio border. So when we look for people in this field, licensed clinical social workers and others, we run into the issue that the folks from Ohio can work without supervision. It's very difficult to convince or coerce these people to come and work in our area and require that level of supervision. We are getting into this world much more because slowly and surely we've come to the realization that as our community hospital has tried to serve the acute medical needs of the people of our region, we cannot fully do that without addressing the behavioral health, mental health, addictions issue, and other social issues that these people face. It took us a while to get there, but we're there at this point in time. Now it comes to getting the people that we need to be able to address these issues, and this has become a very big hurdle. So passing of this bill would give us the ability to help these people work at that level of freedom that they do in other states. Be glad to take any questions or any other comments that you need from me.
Any questions for Mr. Putnam? Seeing none. Thank you, Mr. Putnam.
Thank you.
Matt Brooks, and then Dr. Gaff Clark, you'll be on deck.
Thank you, Madam Chair, members of the committee. Matt Brooks, the President and CEO of the Indiana Council of Community Mental Health Centers. Very much appreciate Representative Zemke bringing this bill forward. Great minds think alike. We had drafted very similar language and placed it into the bill that you have on our behalf, Madam Chair. So this is, when I saw this bill, it made me quite happy because it's a time has come. We have major workforce challenges. We have a lot of unnecessary administrative burdens. And what this does is it eliminates some of the unnecessary administrative burdens that take place, requiring either a doctor or a HSPP psychologist to sign off on these treatment plans for which these mid-level practitioners have already been trained. They've already been prepared to do this. They do this on a daily basis. Now, it doesn't give them any ability to prescribe. Everything is within their scope of practice, as we know. And they will identify those things in the treatment plan that are unique to their needs of this consumer so that we don't require this unnecessary administrative burden. We have some cases where we've hired HSPP psychologists simply to sign off on treatment plans. And at $80,000 to $90,000 a year in salary plus benefits, you're talking about almost $200,000 a year just to provide an administrative service and oversight of something that is already done. Something else to keep in mind, in any community mental health center setting, in a Medicaid provider system, the doctor is always the oversight person. So you always are going to have, this doesn't eliminate the doctor being overseeing the activities and work that are taking place within the center. Now, with respect to the amendment, the reason we needed the amendment was that when the addiction counselors were licensed many years ago, probably 7 years ago or so when we created that licensure category, because of the history of some of these individuals, there was a few grandfathered bachelor's level professionals. Bachelor's level professionals are not trained or qualified to develop treatment plans. And so those unique number of licensees that are only at a bachelor's level, we believe are not appropriate for them to be signing off on treatment plans. So that's the reason for the amendment. This is a bill whose time has come, as was alluded to. The surrounding states already allow this, and it would relieve so much administrative burden. We would appreciate your support. So thank you. I'd be happy to answer any questions.
Could you appear on third reading to help us explain this on the floor?
I'd be happy to.
Thank you.
If I'm invited, I have to be invited.
Thank you.
Thank you.
Seeing no questions, Dr. Clark, and then Kathy Williams.
Thank you for giving me the opportunity to address this committee here today. Again, my name is Dr. Carla Gaff Clark. I am not a medical doctor, and I'm not an HSPP. My doctorate is in education and counseling. And I come here today representing the Mental Health America Board, which I have served on Mental Health America of Indiana for going on 20 years, and I am chairman of the Public Policy Committee. This is an issue that has been brought to our board and to the agency for a very long time. So one of the reasons that I'm also looking at it and speaking on it today is I have taught as an adjunct professor at Butler University and at Indiana Wesleyan University in the graduate counseling program for about 25 years. I also do trainings for advocates and therapists and counselors all over the state through the Indiana Coalition Against Domestic Violence. In those positions, I have written a lot of curriculum and trained and helped train and help with the minds of students and advocates. Where we are today is, like Mr. Brooks has already said, we are at a point where we are needing more people out there, and the quicker we can get them out there, the better. Definitely, the scope of practice is huge in this, and the training and the education is the majority part of why I stand here today to say that I do believe, and that the MHAI stands behind believing, that our licensed mental health counselors, licensed social workers, licensed clinical addictions counselors, and licensed marriage and family therapists are trained and are ready to do more of this, getting the workforce out there and quicker and moving along a lot faster. I believe in my roles over the 25 years, I have definitely had a chance to see what we are doing and what is working and what isn't. And as Ben already alluded to, there's definitely pockets in the state. When I do trainings down in Paoli, Indiana, for example, they are really hard put to make these regulations all work because there's not the workforce there. So I want to thank you again for allowing me to be here and to urge you to support House Bill 1175. And do I have any questions?
Seeing none, thank you so much.
Thank you.
Kathy Williams, I presume you're a Me Too, so brevity is always best. And then Dr. Stolke.
Thank you, Chair Koffer. I'm here today on behalf of the National Association of Social Workers, and yes, we strongly support this bill. We're very happy to see the licensed clinical social workers included in this. Thank you, Representative Ziemke, for filing it. We were hoping to have an LCSW here today. She couldn't be here, so with your permission, I'll distribute her letter to the committee.
Sure, thank you.
Thank you.
Any questions for Kathy? Seeing none, thank you. And then, Dr., I don't know if I'm pronouncing your name properly, Stokel or Stokely. Oh, sorry, I didn't see you over there. And then Dr. Osborne, you will be our final testimony.
Good afternoon. I'm Dr. Nanette Stackel. I work for Indiana Wesleyan University. I'm actually the program director for the Marriage and Family Therapy program. I've been with them for 10 years. I also serve at the Indiana Association Marriage and Family Therapy for the last 4 years. And over the last 2 years, I've also have served at the Indiana Counseling Association board. So I have the privilege to represent both the Marriage and Family Therapists of Indiana and also the Indiana counselors, mental health counselors, who couldn't have an additional representative today. So, first, I want to thank Representative Ziemke for authoring the bill and Representative Kirchhofer for hearing this bill this afternoon. As I stated, I'm representing both the mental health counselors and the marriage and family therapists of Indiana. And we both agree that we're both programs that we're both independent, licensed as independent providers in the state of Indiana, whose licensure, as it was stated earlier, does not require to have oversight in order to provide services to the general public. And also, as stated earlier, currently Medicaid requires us to have a signature from an HSPP, which makes it a little bit more cumbersome and also not cost effective. And therefore, we do not have as many MFTs or mental health provider counselors providing services as we could. Unfortunately, this is a disservice because we have research, which actually in 2014, there was a major study that looked at 22 different independent studies over the 20 years of 250,000 cases of individuals and families who actually ended up seeking fewer health services because of having received systemic therapy. And this was pretty much broad in the cases, so it wasn't just a specific group, but even when you just looked at the individuals who had frequent more health services, they themselves sought fewer services as well. So actually including mental health counselors and marriage and families, as we stated, would actually save the state money. So thank you. Any questions?
And I butchered your name. Would you pronounce your last name again?
Sure. Stackel.
Stackel. Any questions or comments for Dr. Stackel? Seeing none, thank you so much. Dr. Osborne, representing the Association of Addiction Professionals.
I'm Dr. Don Osborne. I'm the Director and Professor of Clinical Addictions Counseling at Indiana Wesleyan University. Here representing the Indiana Association of Addiction Professionals, and I'm the past National President of the National Association of Alcohol and Drug Abuse Counselors. This is an issue that I have been working with nationally for quite some time, and I want to thank Representatives Zemke and Kirchhofer for presenting this. At this particular time, I'm happy to say that a bill such as this has been on my bucket list for quite some time. Not to say that if it gets passed, I'm ready to leave, but looking forward to the success of it. As you know, in many places in Indiana, we have a workforce issue, and to find a provider is uniquely a challenge to find someone reputable and well-trained to meet the treatment needs. By virtue of the fact that in Indiana we've already given licenses at the master's level to a number of individuals, we've already established their competency, both not only academically but in their professional training that has gone on with treatment planning that we're seeking to grant. One of the things that we will sometimes find is that there are some treatment facilities that do not include licensed clinical addictions counselors, when it is well known that the majority of people seeking services, given the opioid issue, need to see addictions counselors or licensed clinical addictions counselors. As a result, it's the equivalent of we have ourselves or a family member that has cancer and we don't have an oncologist on staff, but we'll send you to a cardiologist. We would not do that in any other medical setting. And it shows in some ways how we have pictured and how we've looked at the provision of the needs of those with addictions and also the resources of the addictions counselors who are licensed and ready to serve. There may be some issues that have come up along the lines as to what we look at as far as academic preparation. The majority of students, whether they are in clinical social work, marriage and family, clinical mental health, or addictions, have had a course in psychopathology, understanding the process and the etiology of some treatment issues and treatment needs. That's also been followed by a course in practicum and also possibly 2 internships of where they have undergone clinical supervision with a number of university supervisors and of course site supervisors as well, providing clinical supervision, and of course their postgraduate work as well. So in this particular regard, I'm happy and pleased that this bill has been brought forward. I will give my endorsement to it in the Indiana Association of Addiction Professionals, and thank you for hearing us and being here today. Any questions? Okay, thank you.
Seeing none, thank you. Representative Zemke to close, and also have you considered request of co-authors? I didn't see any yet on the list. So
No, but I would love co-authors. Would you, Madam Chair, be
I
a
would,
co-author?
I would love to, and I would love it if you might get a Democrat on the
Yes.
Health Committee.
Representative Shackelford, I'd love to have you on the bill. Thank you. Thank you so much, Madam Chair, and to the committee. This is just so very important in the work that we're doing up here to combat drug addiction and to provide the treatment that we need. And I know in my years of personally advocating so much for this, I was very excited when this bill came to me. So I thank you all very much for your support, and please, please consider voting for this bill. Thank you.
Will of the committee discussion? Representative Bacon, did you have a question or comment?
I did have one question, Madam Chair, and I should have asked it with probably with Mr. Brooks, but this will not affect reimbursement for any of those that pay for addiction counseling and so forth. So they're going to still allow the signature plan of care with these individuals.
This is simply for Medicaid billing to be allowed by these licensed people without the oversight for the treatment plan.
So it has no effect on any other private insurance and so forth?
No,
Just for Medicaid?
Medicaid only.
Community mental health center setting, and someone's going to have to sign off on that treatment plan anyway. We're just alleviating the boondoggle or backlog. Thank you. So I believe that there was a motion. Was it as amended, Representative Frizzell? And there was a second. Mr. Winning, call the roll.
Representative Kirchhofer.
Yes.
Representative Lindauer. Yes. Representative Bacon.
Yes.
Representative Barrett. Yes. Representative Davison.
Yes.
Representative Fleming.
Yes.
Representative Frizzell. Yes. Representative Hatfield. Representative Leahy. Yes. Representative Manning.
Yes.
Representative Porter.
Would you please add him to the end?
Representative Shackelford.
Yes.
Representative Zent.
Yes.
Representative Porter.
Excused. Passes 12-0. Congratulations, Representative Zimke.
Thank you so much.